My name is Brisebois, and I will be reviewing the Community Organization Plan Change Project for the McDuffie School. Although the McDuffie School has a strong residential life system, currently there is not a consistent or structured approach to identifying and addressing homesickness among international boarding students. As a result, resident assistance responses vary. Early intervention is inconsistent, and student distress can escalate before appropriate support is provided. The problem exists within the McDuffie School's residential life system, which operates across micro, meso, and macro levels. Within this system, the social work change agent plays the role of facilitator, program developer, and evaluator by working to strengthen RA capacity and advocate for the students, implement evidence-informed interventions, and assess outcomes at both the staff and student levels to create a more cohesive and responsive residential community that uphold the school's circle values. The McDuffie School is an international boarding school for grades 6 through 12 located in Granby, Massachusetts. International students make up approximately 50 to 65% of the total student body, representing 24 to 25 different countries. These students live on campus in a residential model. Within this setting, residential assistants, or RAs, play a central role in supporting student well-being, providing day-to-day supervision, emotional support, and early identification of concerns such as homesickness. The residential assistant role blends micro and macro level social work practice by combining individual student support with broader community and systems involvement. Additionally, they mediate conflicts through restorative justice practices and uphold institutional policies that ensure safety and accountability. Based on Thurber's 2007 suggestions, homesickness prevention focuses on preparation, normalization, and early intervention through gradual separation experiences, psychoeducation, and structured coping strategies. Residential staff play a critical role by identifying homesickness through behavioral changes, building relationships, and fostering belonging through consistent engagement. Parental support further reinforces adjustment by promoting independence, confidence, and positive expectations while avoiding rescue behaviors. Within this setting, there is currently no consistent or structured approach to addressing homesickness within the residential system. While RAs play a central role in supporting student well-being, the absence of a standardized protocol results in variability in how homesickness is identified and addressed. Feedback from students indicates that structured homesickness support has not been consistently available, despite students recognizing that their peers often struggle during the transition. This suggests a gap between student need and the current delivery of residential support. According to Ward et al. From 2001, it is not uncommon for international boarding students to experience adjustment stress from a new school culture, including homesickness, language barriers, and identity shifts during the transition from home to the school. Research by Ryan from 2011 suggests that separation from family systems and unfamiliar environments can intensify emotional distress and homesickness among international students. Strayhorn in 2012 found that when students feel a strong sense of belonging, it improves student persistence, well-being, and overall adjustment. Hypothesis. If the resident assistants are supported, then we can expect that all facets of the boarding life for students, including the homesickness programming, will be improved for the students. During the first 30 days, we will use SMART objectives for evaluating program strengths and to determine our theory for change. We will engage all stakeholders in a collaborative community effort, including RAs, Dean of Students, and the head of school for their input in a culturally responsive way, fostering inclusivity with a bottom-up approach instead of an authoritative top-down approach. The Fisher article from 2009 reviews theories of motivation and leadership and explains that effective leaders adapt their style to employees while promoting collaboration, which can lead to innovation. Including RAs in the process will strengthen buy-in and create a sense of ownership with new goals being implemented. When RAs are meaningfully engaged in decision-making, they are more likely to feel empowered and invested in outcomes that are sustainable. They can help identify structural barriers. This participatory approach will strengthen staff trust and guide program improvements. It not only supports their professional development, but also enhances the broader school community, which is essential for effective and lasting organizational change. This intervention, outlined by Den Braber in 2013, reflects economic theory by using existing resources to deliver a cost-effective early intervention that enhances student outcomes while reducing the need for more resource-intensive responses. The McDuffie Change Program for residential life staff and international boarding students will be evaluated at 30, 60, and 90-day intervals. To further assess the organizational context and factors that may influence implementation, a SWOT analysis was conducted. It highlights key factors influencing this intervention. A primary strength is the residential life structure, which supports consistent relationship-based contact between the RAs and students. A weakness is the lack of a standardized homesickness protocol, resulting in variability in response. Externally, there is an opportunity to align with the growing emphasis on culturally responsive support for international students, seen as off-campus homestay opportunities, while a key threat is the variation in how distress is expressed across cultures, which may limit a standardized approach. An analysis structure presented by Ferguson et al. In 2018 can be used to evaluate this program in gaining a better understanding of how it functions within the school community using macro therapeutic interventions, MTIs. It is an intentional framework for integrating structural change efforts with simultaneous benefits to participant well-being. This shows that structural change can improve individual well-being, thus inferring that empowered individuals will create broad systemic transformations. Using this framework, we review how the implementation of this program may impact staff and students at the McDuffie School. To properly evaluate homesickness, the intervention should be implemented at the start of the academic year. After interviewing several of the RAs and discussing this plan with them, they seem to think it can effectively be carried out. Additionally, I interviewed one-on-one with several of the boarding students to gain a deeper level of insight into this by asking if they thought a homesickness program would be helpful to them at the start of the school year. They each said it would be helpful since in the past they have not had this type of offering. They acknowledge that several students who they are close with had a hard time with homesickness and would benefit from this programming. The goal is to improve student adjustment and reduce homesickness-related distress among residential students through the implementation of structured homesickness supports and early intervention strategies. The outcome objectives are to reduce homesickness-related incidents escalated to administration by 50% by 90 days compared to the baseline, and to increase average student-reported sense of belonging and perceived support to greater than or equal to 4 out of 5 on a Likert scale by 90 days. The process objectives are to achieve greater than or equal to 95% completion rate of nightly and weekend homesickness check-ins at 30, 60, and 90 days. Objective number 2 is to conduct student focus groups at 30, 60, and 90 days to assess program effectiveness and identify barriers. Objective number 3 is to ensure 100% of residential staff complete training on homesickness identification and response protocols prior to program implementation. Activities include having the residential staff implementing nightly and weekend check-ins, providing early intervention support for homesickness, facilitating peer-to-peer support conversations, and participating in ongoing training and evaluation processes, including student focus groups and data collection at 30, 60, and 90-day intervals. RA data collection methods. We will measure effectiveness of implementing homesickness supports and residential interventions co-designed by team members to ensure cultural relevance and responsiveness through mixed method data collection and triangulation. This will be done by finding the REACH compliance rate via the REACH student life management system that McDuffie uses for safety to track students and as a communication system. We will track percentage of nightly weekend homesickness check-ins completed on time with 5% or less missing data with a goal of at least 95% compliance at 30, 60, and 90 days to ensure consistent early intervention as a quantitative method collection. We will use conflict escalation rate that monitors the number of homesickness-related incidents escalated to administration, aiming for up to a 50% reduction by 90 days compared to the 30-day baseline through increased peer-to-peer support and early RA intervention as a quantitative method collection. Focus group meetings with RAs will be done by using open-ended questions at 30, 60, and 90 days to assess what is working well, what barriers exist, and how students are responding to homesickness supports, capturing perceptions, experiences, and meaning as a qualitative method collection. We will use the RA Empowerment Survey Score to measure average RA agreement on a 1 to 5 Likert scale on feeling confident, supported, and clear about expectations and addressing homesickness, with a goal targeting at least 4 out of 5 at all time points, with continued improvement over time as a quantitative method collection. Student data collection methods. We will measure the effectiveness of implementing homesickness supports and residential interventions co-designed by team members to ensure cultural relevance and responsiveness through mixed method data collection and triangulation. We will look at the student check-in participation rate by tracking the percentage of nightly weekend homesickness check-ins completed by students on time with 5% or less missing data, with goal of 95% or higher participation at 30, 60, 90 days to ensure consistent early support and engagement as a quantitative method collection that is not just for safety and location of whereabouts, but it is the delivery mechanism through which homesickness programming actually happens in daily residential life. We will look at homesickness-related escalation rate by monitoring the number of student homesickness-related concerns escalated to administration, aiming for up to a 50% reduction by 90 days compared to the 30-day baseline through increased peer support, coping skills, and early intervention as a quantitative method collection. We will set up student focus group meetings and use open-ended questions at 30, 60, and 90 days to assess what is working well or what barriers students are experiencing as a qualitative method collection. We will use student support and belonging survey scores by measuring the average student agreement on a 1 to 5 Likert scale on feeling supported, connected, and clear about available homesickness resources, with a goal of at least 4 out of 5 across all time points, with improvement over time as a quantitative method collection. Hypothetical RA assessment findings. If positive findings are observed, the data will demonstrate that nightly RA check-ins are being implemented with high fidelity. At least 95% reach compliance, confirming that homesickness programming is consistently found in daily residential life as a proactive support mechanism rather than solely a safety protocol. This will be accompanied by a measurable reduction up to 50% in homesickness-related escalations to administration by 90 days, indicating that early identification, peer support, and timely RA intervention are effectively preventing distress from getting worse. Qualitative data from RA focus groups will show improved student engagement, increased disclosure of homesickness, and fewer signs of emotional distress, while also identifying changes to strengthen programming. Additionally, RA empowerment survey scores with 4 out of 5 or higher, with improvement over time, will indicate that staff feel confident, supported, and clear in their role, reinforcing program sustainability and overall effectiveness. With positive findings, an RA is consistently completing check-ins, confidently identifying and addressing early signs of homesickness, building strong relationships that increase student disclosure and engagement, preventing issues from escalating, and feeling valued, supported, and clear in their role. If improvements are being made in some areas and not others, through a critical theory lens, we should ask why it is not working across all demographics. Is it a cultural issue? Are we not being inclusive and equitable to all? For example, there could be language barriers or cultural misunderstandings among RAs towards students. We should actively identify disparate impacts across different populations. If negative findings are observed, The data will indicate the opposite of the positive findings and show inconsistent implementation and limited impact of the homesickness intervention. This can indicate that an RA is inconsistently completing check-ins, missing early signs of homesickness, experiencing low student engagement, and feeling unclear, unsupported, and less confident in their role, which results in more issues being escalated to administration. If negative findings are found, adjustments will be made using a continuous improvement approach while keeping the core structure of RA-led check-ins in place while refining how they are delivered based on identified barriers. Ongoing data collection at 30, 60, and 90 days will guide ongoing adjustments, which will help ensure the intervention is effective within the residential setting. Hypothetical student findings. If positive findings are observed, the data will show that students are consistently engaging in nightly and weekend check-ins, receiving early support through residential programming, and experiencing fewer homesickness-related concerns that require escalation to administration. Qualitative feedback from student focus groups will reflect that students feel the supports are helpful, responsive, and relevant to their needs, while student support and belonging surveys of greater than or equal to 4 out of 5 with improvement over time will indicate increased feelings of connection and support. Collectively, these findings would suggest that homesickness programming is strengthening student adjustment, belonging, and coping during the transition to boarding life. According to Tinto from 1993, early and consistent engagement through supportive relationships is a key factor in student retention and successful adjustment. Negative data would show the opposite of the positive findings, and with negative feedback, students are inconsistently engaging in check-ins, feeling less supported and connected, struggling to share their experiences, and experiencing continued or increased homesickness-related issues that escalate to administration. For adjustments, I would implement data-informed goal changes among the residential staff while simultaneously evaluating the effectiveness of those changes over time. This initiative is a dual-focused program evaluation that operates at both the staff and student levels. On one level, this project centers on strengthening RA competence through structured expectations, feedback loops, ongoing support, and training, with the goal of increasing their confidence, consistency, and sense of empowerment in their roles. On a parallel level, RAs would be responsible for implementing a structured homesickness support intervention at designated intervals throughout the academic term. This is designed to proactively address the emotional and developmental needs of international boarding students where the transition and separation from family systems are commonplace. This approach intentionally integrates micro and macro level practice by linking staff development to student outcomes, which allows for measurable changes not only in RA performance and engagement, but also in the quality and effectiveness of student support. By evaluating both sectors concurrently, this project creates a feedback-informed system in which improvements in staff capacity are expected to directly enhance student well-being. This ultimately contributes to a more responsive, supportive, and cohesive residential community. To adapt flexibly if there are negative findings, the program would need to simplify and embed check-ins into natural routines to improve participation, shifting from task-based check-ins to relationship-driven interactions to build trust and increase student disclosure. We will incorporate student feedback to ensure supports are culturally relevant and engaging. We would provide RAs with targeted training and supervision to improve early identification and response. Ongoing data collected at 30, 60, and 90 days will guide ongoing adjustments, which will help ensure the intervention is effective within the residential setting. And at the 90-day mark, we will meet with stakeholders to evaluate if changes are being met and if they are effective. Ongoing structural evaluation should be done once a year with openness for flexibility and adaptability. Planned outcomes of the intervention, such as consistent RA check-ins, high student participation, and reduced escalation rates, reflect strong implementation fidelity, indicating that the program is being delivered as intended. Research by Aston from 1999 shows that student outcomes are strongly influenced by the quality of interactions and involvement within their living and learning environment. To engage this organization to the larger Granby community to strengthen this intervention, we could increase the number of homestays to be more inclusive for those that cannot afford to live on the campus. In the future of ongoing evaluation, the homestays could be included in the data collection process. Unplanned consequences may include cultural mismatch in how homesickness is expressed and addressed within a diverse international student population, as well as increased reliance on RAs for emotional support beyond their scope of training, which may delay appropriate referrals. Mixed theories applied in this macro social work change project include economic theory, empowerment theory, social planning model, strengths-based organization theory, human relations theory, and critical theory. Focus change. This intervention represents a focus change as it is a targeted intervention focused on specific improvements in RA practices and homesickness support while improving existing residential systems. Examples of this include improving check-in consistency and adding a homesickness protocol and training RAs on one skill set. Summary. The organizational vision is to inspire staff and stakeholders toward a common purpose that reflects the core circle values. The mission operationalizes the vision. By focusing on the RA's needs, we can inspire them to implement and succeed at the homesickness programming. The importance of evaluation in social work is to be able to use evidence-based practice, ensuring social work interventions are effective and impactful. It is also used for advancing practice and policy. We can utilize evaluation findings to advocate for policy changes and improve social work practice. And in using evaluation in community settings, we benefit from research contributions such as that introduced by Thurber in 2007 in preventing and treating homesickness. Additionally, as a social worker, I can contribute to this evaluation as a change agent by publishing my findings for improvements in the residential life community at boarding high schools. Thank you for listening to my presentation.